Doctors of Reddit, what was your dumbest r/I am very smart patient experience? RN here. I see some crazy stuff. But one thing that stands out was the time I was admitting a guy to the hospital. I can't really remember what for, but he was about 400 pounds. Diabetic. Heart disease. You name it. Anyhow, I'm at the computer going over some admission questions with him and his 10 family members who are crowded in the room with him. A few minutes and he starts complaining that he's thirsty. He needs something to drink right now. So I get on my phone and call the nurse assistant and ask her to bring in some ice water. As soon as the words are out of my mouth, the whole family screams no water. He's allergic to water. Well, this is gonna be a problem. Turns out the guy had been drinking nothing but Sprite and sweet tea for years because of his water allergy. The next question the wife had was, where are we all supposed to sleep? The whole family, 10 people, were planning to stay at the hospital with him. You can't make this shit up. I work in the ER. We had a very pregnant patient come in needing stitches in her vagina. Turns out she was a realtor and didn't want her water to break while she was showing a house. So she put a glass cup in her pants to catch the water. Instead of using a pad or an adult diaper, she went for a glass cup. She sat down while showing a house and sure enough, it broke and cut her up pretty bad. Between the guy putting arm blood into his penis and now this, I don't think I'm gonna see my genitals again for a couple of days. Was working at a clinic. I was speaking with a non-controlled diabetic patient about her sugar intake, and she said she drinks a 32 ounces soda every day. I ask her if it's regular or diet, and she replies with it's half regular. I'll let the ice melt first so there isn't as much sugar in it. Sorry, but that isn't how it works. I have had several arguments with diabetics about Coke/Kool-Aid/sweet tea vs those made with artificial sugar. I tell them, look, don't drink sugar. If you have to have something like that, use an artificial sweetener. No way. That stuff is poison. It will kill me, ma'am. Your A1C is 14. Sugar is already killing you. Apostrophe. I had a patient who was a completely non-compliant diabetic, smoker, morbidly, who had his first heart attack at 45. His blood pressure was also super high, and instead of taking his antihypertensive medications, he went to the gym. In the gym, he would sit in the sauna for a very long time and sweat a lot and lower his blood pressure by becoming dehydrated. I have one. I got this from my friend, who is a doctor on the children's ward in a rural hospital. These parents bring in their child whose hair is infested with lice. The lice was visible to the naked eye and could be seen crawling on the child's clothing. While the medical staff examined the child, in order to determine a course of action, they discovered the child was covered in a white powder and smelled heavily of chemicals. They asked the parents what were the substances and the smells emanating from the child. The parents said, quite matter of fact, it was 7 powder and flea and tick spray they used on their dogs on the family's farm. Needless to say, social workers were notified about this case. Had a neighbor in rural TN who was convinced that the best way to treat her child's head lice was to comb diesel fuel through it, and that doing it in an enclosed living room while smoking cigarettes was acceptable. She was baffled when CPS took her kid away. 70-year female tripped and fell 2 days ago. She came it with hip pain, but reports after the fall her nose was bleeding. She had landed on her nose. About a year prior, her dentist had messes up an infraorbital nerve block and caused some swelling in that region, but that all was resolved. This old lady is now convinced her nosebleed after falling on her face is related to an infection from the dental issue a year ago. After multiple back and forth on the etiology of the nosebleed, she became the first patient I raised my voice and put down an authoritative no. You are wrong. Just stop it. I work for an optometrist, and it was the month before school started, and a woman brought in her son to have his eyes checked for the first time. Seems like a pretty reasonable thing for any parent, even if he was a little older than usual for a first eye exam. Better late than never, I guess. The mom was well spoken and appeared fairly intelligent. Everything went as normal. The doctor examined the boy and ended up prescribing glasses. When the doctor was explaining to the mom that her son had to wear his glasses all the time, since he's nearsighted and basically can't see clearly past 5 feet in front of him, and will definitely need glasses for school. For some reason this caused a switch to flip in the mom, and she spazzed out on the doctor, saying that her son doesn't need glasses and that the doctor is only saying that he does because he wants to sell glasses. She says that she only brought her son in because there was some form for school that needed to be filled out, and that doctors are all con artists trying to push unnecessary medications and interventions. The doctor tried to calm her down and explain that he's only trying to help them, but that she was free to get a second opinion, and gave her a copy of the kid's prescription and sent them on their way. About 4 months later the lady is back asking for another copy of her son's prescription. Apparently the first semester midterm results were in, and her son failed them all because he couldn't see the board in his classes and needs glasses. Something similar happened with my mother when she was a kid. If I recall the story correctly, she was about 3, and she'd always sat real close to the TV. My grandma kept scolding her for lying because she could see just fine. Well, grandma got tired of hearing excuses and took my mom to the optometrist. The optometrist told her in no uncertain terms that she was nearsighted and needed glasses. My grandma was shocked at the news, came back later to get the glasses, and on way out, my mom looks up at her mom and says, "Mommy, I can see you." Apostrophe. My grandma just crumpled in tears at that. Any variation of this, which I get all the freaking time. Me, so how are things going with your diabetes? Them, I don't have diabetes. Me, them, why are you talking metformin / Victoza / whatever? Them, I used to have diabetes, then replaced diabetes with hypertension / antihypertensives etc. Or when I ask them what medical diagnosis they have, and they say none, while taking a ton of meds. Or when they misname a body part, prostrate, tendon, numerous, to name a few. Do you take any medications? No. Are you supposed to take any medications? Yes. What for, and do you know what they are? No. Do you think this chest pain could be because of the heart attack I had a few years ago? Me, is there any chance you could be pregnant? Patient, definitely not. Me, are you sexually active? Patient, yes. Me, what is your preferred method of birth control? Patient, nothing. Me, SMH. Not a doctor, but I'm a nurse who worked in or at a trauma center. Was doing surgery on a 19-year-old who tested positive for meth and cocaine, who was grilling the anesthesiologist about every drug we were going to use in surgery because he doesn't like putting chemicals in his body. Gotta stick with that organic, fair trade, non-GMO cocaine. Another tales from a trauma center, since you'll like the last one. Guy is trespassing in a junkyard and gets his arms and legs ducked up by a pit bull. Have to clean out all these wounds. Flash forward to 3 AM that night, I get called in to do a case. Apparently the guy left the hospital ammo to go get revenge on the dog, and the dog bit him in the face, breaking some facial bones and poking a few more holes in the process. Classic. Most of my own stories go along similar lines to patient has chest pain driving a coach load of school children. Thinks it's indigestion. Swigs bottle of Gaviscon. Later diagnosed with a huge heart attack. My favorite ever story from a colleague. A patient comes into R&D with abdominal pain. As part of the workup he gets an abdominal x-ray which shows the problem as clear as day. The colleague has then proceeded to remove from the patient's rectum an 8-inch replica of Nelson's column, the statue in the center of Trafalgar Square, London. On showing it to the patient, the response was, "Oh, that's Nelson. He lives up there." Apostrophe. I've got 2 stories that stick out in my mind. The first is the mother of a toddler who came into emerg. The kid had cruddy green / bloody stuff coming out of his left nostril, and a lot of redness and swelling of only the left side of his nose and the adjacent cheek. Mom was sure he caught a sinus infection and just wanted some antibiotics. Now I know some kids like shoving whatever will fit into their body orifices, and that this was more than likely given the one-sided nature of his condition. But mom was insistent that he never puts things in his nose. It took some convincing, but I finally got her to let me take a look. Gave a squirt of midazolam in the good nostril to settle him. then dug with some tweezers through the crud until I pulled out a big old button battery. It would been burning his nose for a couple days. Hopefully he healed up well. Side note, if a kid swallows a button battery, it can do a similar thing to their esophagus. This is an emergency and needs to be dealt with as soon as possible. Patient had a hard time getting pregnant. Finally conceived but miscarried. Patient has a DNC, so she can try again. This time with medical intervention. We monitor her blood to ensure the pregnancy hormone is gone before beginning treatment. But she keeps coming back with high levels of hormone. Docs are worried because she might have some retained placenta or pituitary disorder, and this could be super bad for future fertility. We call her in for a conversation about the hormone levels not going away. After talking together about what might be wrong, they are going to go home and think about further tests. She says, I need to go. I have an appointment at the weight loss center for an HCG shot. Turns out that she is on the HCG diet. HCG is the pregnancy hormone. And this was after an hour of the docs saying, we don't know why you have these constant high levels of HCG in your blood and we are worried. Patient inquiring about birth control was adamant she wanted an IED. Had a young woman with recurring UTIs that began after a recent partner and with no STDs, went through the standard questions trying to figure out what could be causing them, and eventually found out she had been lubricating with jelly, not Kai jelly. The mix-up had literally been a joke on house. It took me some effort to keep a straight face, but we eventually resolved the problem and she stopped getting UTIs. I'm a corpseman, not a doctor. But I once had a patient tell me that there was no credible research that smoking was bad for one's health. Okay. 80 plus Y. Oh. Patient who was declining with multiple diagnoses and about 3 decubitus ulcers. Daughter was adamant that her father be kept on his strict paleo diet because that would supercharge his healing. She had a stack of diet books. He simply wasn't getting enough nutrition to heal the ulcers. He didn't like the diet at all. BTW. At some point you kind of have to stop being polite and just tell patient/family members bluntly that you don't have time for this shit and what you recommend, and they can do what they want, and just document everything. It happens a lot, but she sticks out. Oh yes. We had an elderly woman with severe malnutrition and her hippie daughter wanted us to only give her raw, unpasteurized goat's milk. We did everything we could to convince her that her mother wasn't getting enough nutrition. We even tried to allow her to bring in the raw, unpasteurized goat's milk that we would supplement with the FDA approved formula we wanted to give her mother through the feeding tube. We finally had to become pretty blunt with the daughter and let her know that her mother was going to die due to malnutrition due to the daughter's unique views on what was a proper diet for her mother. I'm a dental student. One patient in particular is pathological liar. During one visit, they claimed to have gone to medical school. Next visit was that they did dental army. Last visit was that they had a PhD. The patient will say things like, hey doc, do you need me to move my head mesial or distal? No. I need you to move your head right. Hey doc, are these cavities being caused by the anaerobic pathology microbes? No. They are caused by you eating snacks all day and not brushing. Not my story, rather my colleagues. A patient was admitted for anemia and a localized cancer was found. She was referred to surgery so she can get cured from her localized cancer, and she started telling everyone that it was the doctors who caused the cancer and that she was doing just fine. Before coming to the hospital, she lectured the surgeon and my colleague, who pleaded her to get her surgery so that the cancer doesn't advance, and yet she refused, saying she knew better and probably didn't even have cancer. RN here, not a physician, but you may find this interesting. Young adult male presents with multiple abscesses on various parts of his body. States he injected his boyfriend's semen into himself trying to get pregnant. He tells one of the APCs he should have gone with his original plan and tried on his dog first. Psych clears him. Has admitted to the floor and gets 4th antibiotics. What? I've seen enough of Reddit today. Not a doctor. I'm an optician, and at this point I was a young lady in my mid-20s. I had a guy come in saying he was a doctor and he wrote himself a recipe for glasses, and he brought frames. A few days later his lenses come back. He puts on his glasses, and he can't see. I start going through the possibilities. Usually with progressive lenses it's an adjustment issue and they need to sit differently on his face. He completely refuses to let me adjust them. So I check the lenses and the recipe match what he wrote. I try to explain that there's only two options. Either they need to sit differently on his face or the recipe isn't good. He tells me, "You don't understand. I've had eye surgery for a disease that you've never even heard of." I offer to remake his lenses to prove a point. His new lenses come in a few days later. An older coworker is helping him. I told her everything. Again, he can't see. She tells him, "The young girl who tried to help you last time was trying to explain that if we adjust your glasses you might be able to see out of them. Will you please let me try?" He lets her, and suddenly he can see. Granted not perfectly, because he wrote his own recipe and the bottom sentence will explain more. Turns out Duckwood was a lung doctor, and not even an eye doctor. VetTech had a client who was an optometrist and insisted he knew everything about everything. Basically, would try to get meds prescribed for his dog and use them for his cats instead because it was cheaper. I'm a doctor. I understand how dosages work and I know how to split things up. He loved to do this with things that could potentially kill cats very easily, like flea and tick preventives. I personally refused to deal with him because I wasn't going to be the one answering to an inquiry about why he was given inappropriate meds. Was working at a pediatric urgent care. Family brings in their 3-year-old unvaccinated son with autism for a weird rash. They couldn't give me any reason why when I asked them about his vaccination status. Nurse here. The number of American 20-something males who don't know what circumcision is ridiculously high. They think that boys are born circumcised. Evidence, new fathers and mothers asking me what's wrong with their newborn son's penis. He still has his foreskin. Many parents choose to have it removed when the baby is a couple days old. It's called circumcision. Often followed by a parent's question, "What's circumcision?" That's when I facepalm. Please click subscribe if you enjoyed this video.